Cushing syndrome is an endocrine disorder due to high cortisol levels in the blood. Let's go over the normal physiology. Normally, hypothalamus produces CRH, corticotropin-releasing hormone, which stimulates the pituitary gland, also located in the brain, to produce ACTH, adrenocorticotropic hormone, and this stimulates the adrenal gland to secrete cortisol. Let's go a bit deeper into the cortex of the adrenal gland. The outermost layer is the Zona Glomerulosa, which secretes mineralocorticoids like aldosterone. Then there is Zona fasciculata, which secretes glucocorticoids like cortisol. And then there is Zona reticularis, which secretes sex hormones or androgens. In case you need to remember this, a good way would be salt, sugar, and sex. The deeper into the cortex you go, the sweeter it gets. I know, it's not my proudest mnemonic either. So which zone would be stimulated by the ACTH to produce cortisol? Of course, Zona fasciculata. What does cortisol do? Secreted in the blood and bound with cortisol-binding globulins, cortisol has several functions. It is part of the circadian rhythm. It maintains blood pressure, and it decreases inflammation. At a molecular level, it promotes glucose synthesis and protein and fat breakdown. How is cortisol regulated? Two words: negative feedback. High levels of cortisol block CRH production from the hypothalamus and ACTH production from the pituitary gland, resulting in decreased production of cortisol from the adrenal gland. This process is known as negative feedback. Cortisol is also excreted into the urine via the kidneys. So what are the effects of cortisol or high cortisol in Cushing syndrome? Basically, all the functions of cortisol are exaggerated. It results in increased susceptibility to infections, hypertension, muscle, bone, and skin breakdown, and central obesity. Why central obesity? High levels of glucose result in high levels of insulin, which in turn stimulate the accumulation of fat cells in the center of the body, causing central obesity. High cortisol levels also inhibit the release of gonadotropin-releasing hormone from the hypothalamus, affecting ovarian and testicular function. What are the symptoms of Cushing syndrome? Mentioning only the important ones. There is acne, buffalo hump, weight gain, thin extremities, and slow wound healing. And from what we've just gone through, there will also be symptoms of infection, fractures, central obesity, and ovarian or testicular dysfunction. There are also some diseases to keep in mind, particularly diabetes, hypertension, and increased risk of cardiovascular diseases. We can divide the causes of Cushing syndrome into exogenous, due to steroid medications, or endogenous, where the cortisol is made in excess by the body itself. Steroid medications are similar in structure to cortisol, so they can mimic its functions to create such adverse effects. The most common endogenous cause is pituitary adenoma, a benign tumor of the pituitary gland which secretes too much ACTH, which in turn stimulates excess cortisol production in the zona fasciculata of the adrenal gland. Other endogenous causes include small cell lung cancer, which provide an ectopic source of ACTH production. Another cause is adrenal gland tumors, which directly accelerate cortisol production. So how do you diagnose Cushing syndrome? As an initial test, we measure free cortisol in a 24-hour urine sample. If it is high, the test is positive and we have diagnosed Cushing syndrome. Next, we need to check if the cause is endogenous or exogenous. For this, we give low-dose dexamethasone, an exogenous steroid which is normally supposed to suppress the production of ACTH by the pituitary gland and hence decrease serum cortisol levels. This would also be the case in exogenous cause of Cushing syndrome. If the cortisol levels remain unchanged, the test is positive and points towards an endogenous cause. To find out which particular endogenous cause is the problem, plasma ACTH levels are checked. Low levels are seen in adrenal tumors, whereas high levels are seen due to Cushing disease and ectopic ACTH production. If high ACTH levels are seen, we can inject a high dose of dexamethasone, which can cause ACTH and cortisol levels to decrease in case of Cushing's disease. If cortisol remains unchanged, this just means that all the ACTH being secreted is not coming from the pituitary gland at all, so there has to be an ectopic source. How do we treat Cushing syndrome? If the cause is exogenous, due to steroid medications, the medications are gradually tapered off. Medications used in treatment of Cushing syndrome include metyrapone and ketoconazole, which block cortisol production. If the cause is endogenous, such as pituitary adenoma, surgical excision would be required.